Hi, today I want to talk about the intestines because we are just about to start our rectocele and bloating class. So here's a little tip for you that if you're feeling backed up, if you're feeling constipated, if you're feeling bloated for whatever reason, maybe you've been out the night before and you've had food that doesn't quite agree with you, then these are a couple of my go-to things when I'm feeling a little bit bloated or I just need to basically move the intestines. So one of the primary movers for the intestines is the main breathing muscle, which is your diaphragm. So many people get stuck in their breathing patterns that they tend to live up here in their chest. They're using their auxiliary muscles to actually become the primary breathing muscles. And what happens at the end of the day is that the primary breathing muscle, which is your diaphragm, it doesn't descend low enough to lubricate what's below it, which is your intestines. So it's really important to get your breathing right. And 9 times out of 10 with my clients, I find that once we work on their breathing dynamics, the rest of their intestines basically fixes themselves. So as we breathe in, so the couple of things that we're going to do when we're breathing in, you want to try to keep your shoulders still. Now they will move, obviously, because you've got auxiliary breathing muscles connected, but we want to keep them as still as possible. And we want to start to move down below the rib cage. So your diaphragm is a dome-shaped skeletal muscles, which means that it can be strengthened the same as your legs or your arms, which is good news. It can also be stretched as well. So we can stretch the muscles and then they'll contract back. So your diaphragm, when it's at rest, will sit like a dome shape up neatly under the rib cage. As you inhale and you inflate your lungs, then the diaphragm contracts down. And as it contracts down, then it starts to move whatever's below it, i.e. the intestines and all the organs below it. This then helps with peristaltic movement, which is needed then to keep your bowels clear. And then as we exhale, so the diaphragm then relaxes back up into its dome shape. One of the other things that we tend to overuse a lot is our QL muscles, which is our quadratus lumborum muscles. And they're not actually your back muscles. They are situated in the back, but they're actually the most posterior part of your anterior core muscles. And these muscles get overused as compensation for other things. And that leads then to a lot of lower back pain because the QL muscles are also there to stabilize your lumbar region. So this stretch, if you've got SI joint pain, if you've got lower back pain, if you've got constipation, this stretch is really one of my go-to stretches. You'll need a wall or a door frame, and you're going to have your feet parallel to start with. So you just want to be a comfortable distance away, because what we're going to do is we're going to side bend. We're going to open up the intercostal muscles between the ribs here. We're going to really open these up as we're bringing the other side down. The hips are going to shift away from the wall, and all of that together, then that helps them with this QL muscle stretch. So make sure that you're a decent, comfortable way from the wall. So as I say, your feet to start with are parallel, and those sticky out bones, the ASIS bones in your hips, they are pointing forward. So try not to twist in this movement, because again, that's a compensation pattern that we want to avoid. You're going to take the leg that's furthest away from the wall and you're going to cross it behind the front leg, and your feet are going to be flat on the floor. So again, we don't want any compensation patterns going on by twisting the foot or having one foot up on the ball. So both feet absolutely flat. on the floor. Knees are pointing forward. Now, make sure that the lower ribs are over the hips, so we don't want to flare out because we don't want to jilt forward with our pelvis. So make sure that everything is aligned properly. And then when we are set up properly, we're going to inhale as we raise our arm up. So inhale through the nose. And then as we exhale through the mouth, then you can say a ha sound, you're going to take your most outer hip and you're going to push it away from the wall. So inhale, exhale. Inhale, coming back up. So always inhale through the nose. Inhaling through the nose helps inflate the lungs a lot better. It also helps purify the air that goes down into the lungs. So if you're inhaling through your mouth all the time, this is where a lot of people end up with sore throats and they get problems with their lungs and all sorts because you're inhaling pollution. There's nothing in your mouth to actually sterilize or purify the air that goes down into your lungs. Inhaling through the nose, you've got little contractile tissues there, you've got little hairs that filter out all the pollution and that purifies the air. So number one tip, always inhale through the nose. Okay, let's start this again. Inhale. Exhale, pushing that hip out. Inhale. Exhale. So you can do that about 5 times on each side. So I'm going to just turn around and show you what it's like from the back. So this is a QL stretch. So, and you can challenge yourself as well. So you can stand further away from the wall to see if you can get that deeper stretch going. So feet parallel, everything is aligned properly. Take the outer leg, cross it behind the back leg, or the front leg. So your feet are flat on the floor, hand on the wall or the door frame. Inhale through the nose. Exhale through the mouth with a ha or an S sound. Keeping the hips stable, pushing that hip away from the wall. Inhale and exhale. Let's do that one more time. Inhale up and pushing the hip away. It doesn't matter if you can't reach the wall. Inhale and coming up. More important that you do not twist those hips. So everything is absolutely level and straight. So once you've done that 5 times on each side, and the left may be a little bit different to the right, we are not symmetrical. Our left side is completely different to the right side of the body. And it will be normal that sometimes you'll think, why can I reach over on my right side and I can't reach over on my left side? So keep practicing with those and you will get there, I promise you. So the next one are the twists. So imagine that we're doing thoracic twists. So the thoracic part of your spine is the most mobile. Unfortunately, we get stuck and a lot of times our shoulder blades are not able to move, which translates down into the thoracic spine. And that then inhibits a good diaphragmatic movement. So we really want to move, as the thoracic spine is the most movable and the most mobile out of all the vertebrae, then we want to encourage that movement. So imagine you're like a jar. So the top of your body is the top of a jar and the bottom is the glass part of the jar. So as we're moving, we want to encourage expansion of the ribs. So inhale, exhale. Now the hips stay forward, that stays stable, and it's only the top part that we want to move. So inhale, exhale as we twist, and back, and only go to your range of motion. So once we've done a couple of twists, then we can use the wall as our prop. So I keep my elbow to the wall and my hand in the just below the ribs there in my waist. So this time we're going to, or we can even just hold on to the rib. This time we're going to hold the top part and we're going to shift the bottom part. So basically my shoulders, well, my boobs are facing forward, and then it's just the hips that are moving. So have your elbow as a stable point, so we're not moving everything. And then we're just going to shuffle around with the bottom, and again, only to your capabilities. So as we inhale, exhale, see if we can go a little bit more. Inhale, exhale. Shift the other side. Inhale, keep going. Exhale, see if I can go a bit more. Inhale. And exhale. And that's it. So those are a couple of things that can help you if you feel a little bit bloated and you just feel really good demonstration of the English language there. So, but anyway, I hope you've enjoyed that, and let me know in the chat if there's anything further, if you found that helpful. I would do this every day, just doing 3 or 4, 3, 4, 5, no more than 5 twists on each side, and even give yourself a break. So if you're doing the QL twists and you're doing 5 of these on each side, go make a cup of coffee, come back, and then do the other twists as well. So you're giving your body time to relax, rest, and then go back down. If you're doing any physical exercise, then what I recommend from my training is that when we're doing sets of 3 or 5, in between each set, and it depends what kind of exercise you're doing, but rest for 30 seconds to a minute before going on to the next set. Again, the muscles need that relaxation time, that downtime. So don't keep pounding the muscles all the time, because you don't want to stress them out either. Okay, I hope that's helped. Let me know.